established labor. Established labor is defined from 5 centimeters dilated up until fully dilated. Now, this is the part of labor when we think about that marathon analogy that would correlate to the second leg. You've already been doing this for a little while and you've still got a little bit to go. And many women describe this part as the hardest part of labor because the contractions are really intense. And by the time you get to pushing stage, you know that it's nearly over and you know that you're going to meet your baby soon. Whereas in established labor, you've still got a little bit of work to do. So that mental strength is really important here. Now, when a woman is in established labor, her behavior will change. So in early labor, she might have been able to have a conversation or do things like watch a movie to distract her from the contractions. But in established labor, the woman can really not do much else except focus on the fact that she is in labor. Many women will go into a kind of trance-like state where it almost looks like that they're asleep in between contractions. They're in their zone, they've got their eyes closed down, and then they will have the contraction, have those deep breathing moments while the contraction is coming on and passing, and then fall back into their trance. Now, this is really important, keeping them in that trance or that oxytocin-filled mind, because when you speak to a woman in established labor or she's asked to do something, this can pull her out of that oxytocin-filled mind and she can get a little bit of adrenaline rush and she may even find it difficult to or painful to speak. So understanding that space around the woman in established labor so that she can just be and do what she needs to is really important. Now, established labor contractions are defined by them becoming rhythmic. So in early labor, those contractions were a little bit all over the place, but now in established labor, they're coming on in a pattern and you're doing roughly 3 to 4 contractions in a 10-minute period. Now, every woman's different. So some women may do 3 contractions in a 10-minute period, but they might last 90 seconds each. Some women might do 4 contractions in a 10-minute period and they might last 45 seconds each. And either is fine. Everyone is different, but it's about the contractions being in a pattern. It's about the woman's behavior being different and changing from early labor. And you won't know this until you get into hospital, but it's about that dilatation, the cervical changes happening as well at this point. And that's how you will understand the difference between when you're in early labor as to when you are in established labor. So some tips for established labor. Keep up the hydration and the regular snacks, and also empty your bladder regularly as well. If you have a full bladder, that can stop baby from coming down. And remember that if your body's dehydrated or it doesn't have energy, you're not going to progress well either. Second thing is continue your optimal fetal positioning. So that's continue your upright active labor. And if you need to rest, laying on your side, having a bit of a rest, but then getting upright again. So using that ball, forward leaning positions, getting in the shower, moving your hips, moving your body is all going to help baby get in a good position, shorten your labor, and help baby to be born. Something else to consider is it's very common to feel nauseous when you're in labor. So using a seasickness band can help. And if you choose not to use a seasickness band, even just knowing that little pressure point, it's 3 fingers from your wrist, and pressing on that point can help with nauseousness as well. Another natural remedy is ginger. So having some little ginger snacks can also help with the nauseousness. Aromatherapy oils as well. There's certain oils that can help with nauseousness, So all of these things can assist, okay? But very, very common. So just remember that whatever you do decide to eat may come back up for you. Another little tip is remember your breathing and vocalization strategies that we discussed in this course, okay? So using those strategies with the contraction, and then when the contraction is not there, actively remembering to relax your body. So pay attention to your body. How do your shoulders and your back and your legs and everything feel? Do they need to soften so that you can remind your body to soften and open so you're not holding in tension? And of course, keeping your birth space nice and calm, okay? So that's with everyone being nice and peaceful around you, having it set up in a way that, like we spoke about in the birth space section, that promotes that feeling of calm and relaxation. And anything that's going to help reduce your adrenaline, increase endorphins, increase oxytocin. So that's your partner or support person continuing those endorphin touch massages, nipple stimulation, kissing, positive words of affirmation, visualizing yourself at the end goal. Okay, all of those things really help with your hormones. And all of these things are going to assist you when you're in good labor to shorten the length of your labor, make it less painful, and help you to achieve a normal birth.